Hello, my name is Crystal Robinson, and I am a registered dental hygienist in the state of Texas. I am also a full-time faculty member at El Centro College Dental Hygiene Department, where I teach preclinical dental hygiene and community dentistry. I'm going to discuss dental diseases in the minority community and how the stages of learning and the Transtheoretical model apply to these key health issues and the population. In addition, I will discuss a potential health promotion program that can reduce oral diseases in this population. Diseases affecting minority adults include periodontal diseases, which include bleeding, exudate or pus, attachment loss and bone loss, dental caries, which include the infection of the tooth due to acids, bacteria, and even negligence, and tooth loss as a result of dental caries and periodontal diseases. The CDC reports that 47.2% of adults aged 30 years and older have some form of periodontal diseases. Periodontal disease increases with age. Around 70.1% of adults 65 years and older have periodontal disease. Periodontal condition is more common in men than women, those living with or below the federal poverty level, those with less than a high school education, and current smokers. The next dental disease that we will discuss is dental caries. The CDC indicates that 91% of adults have had dental caries, of which 27% still have untreated tooth decay. Untreated tooth decay is higher for Hispanic and non-Hispanic Black adults compared to non-Hispanic White and non-Hispanic Asian adults. Of the older adult population, ages 65 and older, untreated tooth decay still affects 1 in 5 of those population. The third dental disease that we will discuss is tooth loss. The CDC also suggests that complete tooth loss is lower for older Hispanic and non-Hispanic White adults compared to older non-Hispanic Black adults. More non-Hispanic Black adults aged 65 and older were edentulous, about 29% to be exact, compared to non-Hispanic White and Hispanic adults. Of this, 19% were over 65 years old. Like many other health concerns, there are also barriers to dental care. Most people do not receive dental care because they have no transportation or access to care. Costs for dental care can be really expensive, even if you have dental insurance. People with low health literacy are less likely to receive dental care because they have no understanding of procedures that will take place. There is also a negative stigma in the community. Many people grew up with family members that have dentures, so why should they consider treatment? Just get the tooth pulled. Another barrier to dental care is lack of trust of services or providers. Many people simply think that dentists are out to get their money versus provide a service that they really need. And lastly, language barriers, cultural and ethnic barriers are also a barrier to dental care. As a result of many barriers, people seek care only when the disease is advanced and the pain is unbearable. Change definitely requires action. So what can the dental professional do to help? First, the dental professional can develop patient education materials by understanding the theory of stages of learning. They can help the patient work their way up the learning ladder. The first rung of the learning ladder includes unawareness. The patients are usually unaware of the severity or negative impact dental diseases have on their overall health. The next level is awareness. Once the dental provider provides education, patients can continue to move up the ladder as they achieve each level. As we move up the learning ladder from awareness to self-interest, the patient has the desire to learn about how dental diseases affect their community, and they then want to become involved. Next, at the involvement stage, the patients engage with patient education that promotes the prevention or restoration of treating dental diseases. They even feel empowered to share the information within the community. Next, the patient takes action. They're actually making the necessary changes needed and forming habits that will continue to contribute to good oral health and conditions. If the educator continues to empower the patient can only move up and gain good oral habits. As we have discussed the learning ladder and how the dental professional can impact growth within that learning ladder, we will now discuss the Transtheoretical model and what the patient can do. The patient can remain open and involved in the theory of the Transtheoretical model. Doing so will introduce new behaviors that will positively impact the minority population and decrease the rate of prevalent dental diseases. The strength of this theory is that it allows the patient education program to provide precise intervention for which the patient is ready. The patient now goes through stages of readiness, starting with pre-contemplation, contemplation, preparation, action, maintenance, and termination. I will now go through all of these stages of the Transtheoretical model, including examples from a patient in a dental clinic. Pre-contemplation stage, the patient has no intention of changing their behavior. At the contemplation stage, the patient is considering making a change within the next 6 months. In the preparation stage, the patient is ready to make a change and actively makes plans to enact the change. In the action phase, the change has been adopted by the patient. The maintenance phase, the patient change has been continuous for at least 6 months. And lastly, at the termination stage, the patient feels if the prior behavior never existed, therefore they're highly unlikely to return to the previous behavior. This stage usually does not occur. An example is a patient enters the El Centro College Dental Hygiene Clinic, which is a free clinic that provides preventative dental services. In the pre-contemplation stage of this phase, a new patient has not had a dental visit in 5 years. She had a bad experience at her last office and was overcharged for treatment. She just wants her free cleaning, which is provided by our student hygienist. According to the patient, she brushes daily and that a cleaning is all the treatment that is needed. During the contemplation stage, the exam is done and patient education is done by our student hygienist. It is determined that the patient needs a deep cleaning, which is free through the school, and a dental referral for an extensive list of treatment including fillings and extractions. The patient is amazed by the dental education she has received and she may think about treatment. The patient continues with her free cleaning as scheduled. The next phase for this patient is the preparation phase. The patient actually returns faithfully for her next 2 maintenance cleanings, and at the 6-month mark, she shows a proof of an appointment to get dental treatment started at a local office. The patient also makes a financial commitment to treatment. Next is the action phase. The patient is active in the restorative phase and consistent in the preventive phase of her dental care. She has had fillings and extractions done as well as her cleaning to remove oral diseases. In the maintenance phase, at the 1-year mark of initially seeing the patient, 6 months after actually beginning the treatment, the student hygienist takes routine x-rays and determines that the patient is decay-free and her periodontal disease condition is stabilized and healthy. With this patient, the termination phase is most unlikely to occur because the student hygienist has provided continuing care and encouragement. However, providers that impact the patient with little to no educational oral diseases most often have patients that involve in the termination stage. In addition, patients that experience tooth loss and wear dentures are more likely to fit in the termination stage because ill-fitting dentures cause discomfort, they cause difficulty eating, and patients become discouraged. They are most likely to neglect future dental care and not comply with oral health education taught for their dental wear and care. To impact the underserved minority population, dental providers and educators must reach out to the public. The Not Without My Teeth Oral Disease Health Promotion, hosted by El Centro College Dental Hygiene Department, will host a 12-month community health fair tour to provide free dental and non-dental related health services and education to underserved areas in the Dallas County. The health fairs will take place once a month in selected community centers. Each month, a different center will be selected in the underserved minority communities. It is important to partner with local public transportation to ensure this population is able to attend the health fairs and seek treatment. Education and preventative measures will be developed to ensure patients have a foundation to excel in the theory of the Transtheoretical model and the theory of stages of learning. Local general dentists and dental specialists will be asked to volunteer to provide free screenings and accessibility to low-cost or free dental care. This will be encouraged through dental days within the community. In addition, we will encourage minorities seeking employment to consider dentistry as a career path. This will open doors to bridging the language, cultural, and ethnic barriers suffered by this community. There is nothing like a beautiful smile. So through our oral health promotion campaign, the dental professionals in Dallas County can give smiles to a population suffering from an oral disease crisis. The patients will obtain quality oral health education that allows them to develop and maintain good oral habits. They will also be advocates to reach others in their community to help increase health literacy and reduce dental diseases.